it's a keyhole, like one of those old school keyholes. And so you can see straight through it, but you still know that you're looking through a keyhole. You see an amazing world on the other side. Sun is shining, green as far as the eye can see. You can see the leaves blowing or the trees blowing in the wind, but you're on this side of that keyhole. And so my biggest thing is trying to teach an individual how to open up that door to get to those greener pastures.
What's up, world? Have you ever wondered what does my friend or cousin or partner actually do at work? Listen to Take Your Homeboy to Workday podcast, the premier podcast to learn about careers and trade. Each episode, I interview guests from different professions and dive into the arcs of jobs held, the education and training received, the skills and experiences acquired along the way, of course, how much you can earn, and then also the intrinsic fulfillment that motivates them. So, for anyone interested in hearing the firsthand experience of a specific career, these conversations are your launching pad. Today's episode is about medical doctors and physicians. Now, after surviving the pandemic, the contributions of our healthcare and doctors specifically can't be praised enough. The capacity to manage patient care, medical knowledge, navigate the politics of a health system, and still possess clear communication is nothing short of a superpower. So, of course, on a show podcast about careers, I had to invite a medical doctor to give us a peek behind the curtain about what that life is really like. And so, who better than the best man from my wedding? That's right, today's guest is Dr. Sean Johnson, a physician that practices family medicine for Novant Health in Charlotte, North Carolina. Dr. Johnson's medical North Star is to empower his patients to play an active role in their own health. But don't get it confused, he is the expert. One of my favorite coffee mugs I've seen is his with the quote, "Don't confuse your Google search with my medical degree," which is humorous and kind of frightening at the same time. I've seen his journey from a biology undergrad to a Howard medical student and now thriving as a practicing physician for 9 years. I'm so happy to have you on and thank you for coming on. Thank you. Welcome to the show.
Oh, thank you for having me. I was elated at the opportunity to be a guest on such an awesome platform. So thank you.
Uh, Appreciate it. So, I gave a brief introduction of what I think a doctor is, but can you explain what it is that you do for the audience?
Oh, of course. So I guess doctor would be the umbrella as far as the profession, but within there you have various or a huge variety of specialties from surgical to non-surgical. I myself I practice family medicine. We'll get into a little bit more how I arrived at that decision, but across the whole spectrum of medical doctoring, um, there's a lot that goes into it. Mainly, we are focusing on diagnosing medical concerns or conditions in the individual. So, a patient would come to us with a list of concerns or problems they're experiencing. Typically, it's a change in something they're used to experiencing, and that's typically the
Mm.
first tip off to something's wrong. And then you come to the doctor to try and recreate a picture as far as a medical idea what could be causing the concerns that's happening. So diagnosis, and then the second piece after that, once we figure out what the problem is, we obviously want to fix it. We all went into our profession to try and help people. And usually that comes in the form of treatment. And so treatment is another huge piece of being a medical doctor. And then you have the aftermath. So making sure that individuals are able to adhere to the treatment plan, can continue forward in the most positive light possible based on our treatment plan. And then there's another piece that I really gravitate towards is the preventative side. And that's
Mm.
really the crux of family medicine as a medical doctor in family medicine.
That's the empowering your patients to own their own health part, getting preventative and them taking control of it, right?
Exactly. Playing as equally an important role as your physician in your own healthcare should be the individual or the patient. And so that's where I get a lot of joy in my day to day from. It kind of goes back to the old cliche. I mean, you can teach a man to fish is much
Mhm,
more beneficial than giving a man a fish. And so that's
mhm,
where I kind of take, if I can teach you how to slowly change your lifestyle to become a more healthy version of yourself, then that's the biggest piece. And that way I can do without medication. And that's also a big focus of mine is trying to limit medication going into the body. How do we do that? Healthy lifestyle, hands down.
mhm, mhm. Awesome, awesome, awesome. So let me ask you this. What drew you to this? I mean, at what age did you know you wanted to be a doctor?
That's a funny question. I get that a lot, actually, more than you think. But if you talk to my mother, she says it started around 6, 7, 8 years old. I don't really remember it the way she can, but she says that that's about when I started saying I wanted to be a doctor. And when she hears it, she's like, okay, that's nice. That's
Yeah,
awesome. But like most children, you expect things to kind of change with experiences as you're going through life. And she then goes on to tell the story that it just never changed. And so it kind of started for me, my memory. I have an older brother who has mental and physical challenges from an accident when he was a really young child. And so, with that, growing up, he was always having to attend different doctor's appointments, whether it's his pediatrician, the neurologist, physical therapy appointments.
mm,
And so, that's what I remember going to all these appointments with different doctors, different caregivers, and me being the annoying little brother asking a million questions like, the doctor's trying
right.
to help my brother, and I want to know why, what's going on, what's happening. And so that's where I remember things kind of starting. That's probably around that 10, 11, 12-year-old mark where I kind of have those first memories. And it just continued and spiraled into more of an inquisitive nature when we start talking about attending different health fairs with my mom, who was heavily in social work in the Hartford, Connecticut area at the time, and seeing that aspect from a public health standpoint, and then kind of getting intrigued by the sciences as you progress through high school and then getting into college. And so it really just kind of fed on, but I think it really started around the time that I recall attending those various appointments with my brother and him being my first real introduction into medicine and how medicine can really help an individual in their day to day.
Yeah, yeah. Wow, wow, wow.
Mhm,
Well,
mhm.
wow. Well, that is a hell of a situation to go through, but I'm glad you are that you I guess what's the right language to use? Leveraged it to help
Mm,
yourself and to help others and help your family. So salute to that.
most definitely, most definitely.
Now, I guess, and so you had that in you as a youth from that firsthand experience of going to the appointments with your brother. Now, as you got older into high school and to college, you chose biology. Why biology?
So that's I'll tell you why I chose it, and then I'll kind of talk to what I have done differently. So biology was kind of I love the sciences, and that again started early on, middle school, high school, when you started your science classes. And so when I was thinking, hey, I know I want to go to medical school, it's going to give me the best opportunity, the best foundation. In my head at the time, it was biology. Hindsight 2020, knowing what I know about medical education now, I think it definitely gave me a very good foundation to build upon when it came into the life sciences
Hmm,
moving forward. But now it's kind of, medical education has evolved to the point where you have a little bit more space to explore different interests in undergrad. And so you have individuals. I did med school with an individual who was theater pre med. I did in
hmm,
med school with an individual who actually had a full career producing movies before deciding to go back into medical school.
hmm.
Psychology pre-med majors, music pre-med. So as long as you can kind of get your foundation within the basic sciences, you do have that opportunity to explore a little bit more in your pathway going into medicine. But I chose biology and it worked out perfectly fine. Why? Because I got where I wanted to be.
Yeah,
But biology was something I was interested in. I enjoy the study of life. I enjoy the study of the human body. So as you get advanced into biology, you start more applying it to like human anatomy and physiology, and that was just kind of the several steps ahead as far as along the biology kind of path. And so it worked out well, but that's kind of where I decided on biology, not knowing a whole lot about medical education, but still it working out great.
Gotcha, gotcha, gotcha.
Hmm.
Now, refresh my memory again. I want to talk to you about some of your first jobs out of college. Now, that summer we lived together in Hartford. What were you doing
Sure,
that
sure.
summer? That was something healthcare related that was building your foundation to become a doctor, right?
Yes, yes, yes. When you're going through undergrad, and we're trying to create our strongest resume in preparation for med school, you want to kind of get different experiences, potentially in different areas of healthcare, whether it be research, whether it be actually hands-on, doing shadowing, working with a physician in the different fields. That summer, I was actually working with a nonprofit in Hartford and working in clinical research, actually. I guess it wouldn't be clinical, more field research, but it
Oh,
was
okay.
looking at the utilization and I guess, the access to the female condom at that time in various demographics in the population.
Right.
Mainly, we're talking about sex workers, and so we were looking at that and trying to see if this was another avenue that we could protect individuals from the spread of obviously HIV/AIDS, but then also other STIs within the community. And so that was a kind of a feet on the ground type of community outreach program where we were looking at different ways to advance the access to certain individuals that could benefit from this tool for protection and health aid. And so, yes, that was a research project I was part of that summer. So it was really cool. And that was a totally different look at medicine. And so I took a lot away from that experience. Got to work with some really sharp minds in the public health space in
Mhm.
Hartford. So that was really cool as well.
Yeah.
So yeah, yeah. And again, is that anywhere tied to what I'm doing today? Not really, but the experience as far as being able to meet individuals from different walks of life and communicating and understanding what their background is, what is their day to day versus what mine was growing up versus what mine is today. And it's just another, I guess, an exposure to another demographic in our population that equips me to just do what I do today even better. And so that was a dope experience, actually. That really
Tight.
was.
Tight. Yeah. Awesome. And I'm glad we got to kick it that whole summer too. That's
And
what's
that
up.
was a good summer as well. Yes, definitely, definitely.
So now let's talk about getting into med school then. And so
Hmm.
what goes into that actually? I know people know there's an application process. You may have to pay some money, but can you take us through the steps of med school getting in?
Yeah, no, definitely. Now, this was back, what, 14-ish years ago, so it might have changed a little bit. But no, basically, it's about the same. So you have individuals that have attended or achieved a 4-year degree, um, typically with a focus and some type of a pre med or pre health focus within their curriculum. That means that you have all the prerequisites you need to apply to med school. So then
Mhm.
that means you have all the pieces as far as your academics. You graduated, and then you take the MCAT, which is the entrance exam. All right, so similar to like the LSAT or your
Mm.
graduate school
The
test.
GMAT.
And so you do that
Mhm.
exactly, and so it allows you to, in some ways, compare individuals on an even field. And so that's how the MCAT's been used for so long. And so you take that, you get your score, and now you have your complete package. So you have your academics, you have your community slash enrichment stuff that you do, and then you have your MCAT. And then you have letters of recommendation. All of that is your package. And then you get to decide which schools you want to send that package to, so to say. So who you're going to apply to.
Yeah. Quick question.
This is a, yes, of
How,
course.
how intense is that MCAT?
Oh man, that thing's a beast. That thing is a beast. Uh, and well, actually, as you go through medical education, it gets a little muddy. At the time, it was a beast. We look at it as that was a monster. Now, do I compare that to my boards? I mean, it's nothing. but that's
Uh,
hindsight 2020. But yeah, at the
right,
time, it
right,
was a
right.
monster. It was what you were pretty much preparing for the previous 4 years from the moment you got onto your college campus up until that point. You were actually preparing for your
Mhm.
MCAT.
And that
So
lead up to
yeah.
taking the test, how many hours a day and how many days a week were you studying?
Oh man. So typically when people are taking the MCAT, you're in school. And so you're studying for your classes and you're studying for the MCAT. And so,
Gotcha.
but typically you're going to kind of create a schedule around a 6 to 8 to 10 week schedule where you're going to be studying for the MCAT. And you have focus groups of where you can study, like Kaplan is going to have a study course that you can take and you can pay for. And there are all these different other companies that I can never recall today because
Mhm.
it's been so long. But no, so they have these study courses where you can take and you actually sit down and you focus on studying specifically for the MCAT. And at that time, it was broken down into, I want to say, was it there was a, I feel like there was a math, there was a basic sciences, and then there was some written portion or something like that. And so, it's changed since then, from what I've understand from talking to my mentees. But so all of that goes into the MCAT, and so it's just a lot of studying and intense preparation. And so you're not really studying the way that we think about studying for a test, that you're taking in school. You're really studying to prepare. How do I take this standardized exam? And that's what it
Gotcha.
comes down to when it comes. Yeah, and so that's the focus with MCAT and all those medical education exams that you have to take. You really have to prepare for the test itself, and not so much the information because you've learned most of the information over the years.
Gotcha,
But
gotcha.
it was a monster at the time, to put it this way. And
Yeah.
so everybody's stressed out. It's crazy. It's always at the same time of year, so everybody's taking it around the same time. So all your pre med friends are, just stressing. It's wild, but you
Yeah,
do it and you
yeah.
take it, and then you get that score back, and then you're like, okay, I can breathe for a moment, and then you got to go apply. So
Right,
now you're
right, right.
competing with, yeah. So now it's like it's an ultimate, adrenaline rush slash stressful time where now you're competing against everybody else to try and get so many slots because there's always so many applicants and not enough slots for medical education. And that's been the trend. And that's why there's been such a push over the past 5, 10, 15 years to try and increase medical schools or medical school slots for individuals because we're actually at a loss. We're down in regards to number of physicians compared to the population with such a growing population. And that's going to be a problem, and has been a problem for a while.
Right, right, right.
So
Yeah, I've heard about that a
yeah.
little bit in rural area. Well, first, thank you for that quick explanation about MCAT. Uh, let's
Yeah.
let's pick up where we left off because you were just talking about you had your package together and now you're about to apply to schools.
Mhm, mhm.
And I guess maybe you were going to share a little bit about how much it cost, and then I guess how many schools did you choose to apply to?
So, yeah, I couldn't even tell you, but it was a lot. I mean, we're talking anywhere from 15 to 20. And a lot of it is really from is anxiety driven. Like, hey, well, maybe, I only finished with a 3.6, where people I'm going to be competing with may have like a 3.8, or my MCAT is like I did well, but I didn't really do as well as the 95th percentile. So you have some concerns, and so you say, hey, let's cast a broad net,
Hmm,
and then
hmm.
you cast a broad net, and then you realize, oh wait, actually, my package is pretty dope, and so therefore, then you start getting a flood of like secondary applications coming back in, and so then you gotta decide, hey, all right, which one of these schools did I really want to go to, and which ones were just kind of safety schools, and so you go through that process, and it's a run. It's most places are gonna have like a rolling admissions, meaning that the earlier the better, and so you might pay X amount of dollars, which I can't ever remember how many hundreds of dollars. It's maybe a couple $100s to do your basic application. And that one you just click on different schools and it sends it out. It's a uniform thing. Then you start getting secondaries back, and your secondaries can be, $50 to apply to send a secondary where it's like supplemental information. They might give you a couple essays to write. They might give you, typically it's like different essays or different questions they want you to respond, more of a personal reflection as far as who you are, not so much getting away from the academic performance and stuff. Like I said, but you might apply to 20 and get 16 secondaries. Those
Hmm,
16 secondaries, each of them are gonna require anywhere from 50 to $150 to send this in and for us to continue you as an applicant. And so it's
Yikes.
it's a lot, man. So it can get pricey, it can
Yeah.
get pricey. And then after that, then you start talking about interviews. So after you send your secondary application, hopefully that school only has one secondary, they don't have a tertiary that you have to send in as well. But once you do that, then individuals, or excuse me, then individual schools will start sending out invitations to interview. And so, and then so you gotta go apply. I mean, go attend that school. They'll do like a whole day or day and a half of the tour. You'll meet with current students. You'll meet with faculty, and then there's an interview process where you'll meet with different members of faculty and possibly even students, and they'll put you on a typical type of admissions interview.
Hmm.
Uh, and so then you gotta pay for that travel, so that's not like a school's gonna fly you out anywhere, so you're paying for your
Right.
travel as well. So it's a
Room,
very,
man.
oh, man, it can be a lot, especially if you don't, have that type of, funds behind you, where I was
Yeah.
kind of like me and mom were like, "Hey, alright, so let's figure this out, how are we gonna do this? Alright, you're gonna drive to Tennessee, we're gonna interview there, and then we're going to actually loop back down to North Carolina and we'll do our interviews there as we're on our way to Georgia." It was crazy. It was crazy. But
Yikes!
but
Yikes!
yeah, so it can be a very expensive process. Long
Yeah.
story short, um, thankfully, I just things came together and I was able to go on the interviews that I needed to go on. Finally gave me a good selection to kind of choose from which schools I wanted to attend or I felt most comfortable attending during my application process and my interview process. And yeah, and Howard ended up being it.
Yeah.
Mhm.
Why did you choose Howard?
As you know, I mean, we attended Florida A&M, and so nothing will ever compare to FAMU. That's just it. But
Yeah.
when I exactly, that's just it. So it's like FAMU and then everything else. But then now, but real talk, it was coming down from Connecticut, going down to FAMU. My mom was super nervous about it, but she was like, "Nah, if that's what you want to do, that's what you do." But we were able to connect with individuals from like the scholarship office, and so these were people that were in place to kind of make sure, hey, your mom did a great job raising you. I'm sure that she instilled everything you need, but if you need something, if you need somebody in that kind of figure where your mom is still up in Connecticut, you have someone here. So I mean, FAMU was a family atmosphere, not just because of the students that and the friendships that we created and the bonds that we created, but actually the faculty. I have several individuals on faculty at that time that would easily call me and say, "Hey, we just wanted to check in with you." You
Wow.
know,
Wow. Yep.
it
Yep.
it was
I
it
can
was it
attest
was
to that
it
too at an
it was and it
HBCU
was
place.
wild. It was really that family feel. It was like, "Hey, yeah, my mom's not here, but my mom got eyes down here, man. I gotta
Right.
still keep that. I gotta still walk her straight. I gotta still represent my family because
Yep.
she's gonna hear back from it." And but it was a healthy thing too. It was a very healthy situation. So in my head, I was hoping to try and find something similar and attending medical school. And so I did find that at Howard. And so I was able to connect with individuals. We're talking about on the day of interview, first time that I met with individuals from my financial aid officer, who was Miss Aitchison, was just everything. Like she just looked out for us so heavily. Um, I had individuals on faculty that were in their early years when we're doing book work for as far as faculty, as well as my attendings in the hospital that were just, were willing to bend over backwards to make sure that you had anything and everything you needed to succeed. And it just became more and more evident as I spent more and more time at Howard University for medical school. And so that's how I decided as far as going to Howard, and it worked out because there were times during those 4 years where I needed someone, and so it was great. It was great to have that.
That's what's up, and thank you for sharing that message because it definitely needs to be heard. I mean, I can even attest to some of my teachers being family. Every time I go to homecoming, I make sure I stop by their
Make
offices.
sure you have to,
You have to,
yes,
yeah,
yes,
because they family,
exactly.
man, because they supported you and
Mhm,
have been a positive motivator. So
mhm,
thank you for sharing that message about why Howard, and I'm glad you got that out of them too. That's what's up to hear. Even though it's
mhm.
not fam, I'm glad you got that out
It is right, exactly. Family,
of
it trickled down.
them. So you got into Howard now, and so break down those 4 years of med school for me. I think, 2 of them are classroom based, and then 2 of them you're actually out in the field, but can you dive a little bit more into what goes on those 4 years in med
Yeah, and so traditionally, it's going to be a 2 year of classroom work where again you're just solidifying your understanding of the basic sciences, in the way of your biochemistries, your pathophysiology actually will be grouped into that first 2 years as well. So it's a lot of learning the textbook stuff.
Mhm.
Also, most again traditional programs, you're going to have your anatomy physiology during that time, and that's when everybody thinks about cadavers in med school and stuff like that from their days watching Grey's Anatomy and all that stuff. So that's what that happens in
Right.
the first 2 years. And then the second 2 years is your opportunity to really apply what you've learned in number one, and then number two, find out what you like to do. Okay, and so those are called your clinical years. So you have your classroom years, and then you have your what we call clinical years, and that's when you're doing rotations. So you might spend 6 weeks in this specialty in pediatrics, and then you might then say that's your pediatric rotation. You learn as much as you can from the doctors and the residents or the doctors in training that are above you, and then you'll have an exam at the end. You pass that unit, and then you go on to the next one. So then you're going to have a 8 week rotation in internal medicine, which is basic again medicine, where you're looking at all of the internal organs, and you're learning things about cardiology. You're learning things about nephrology or the kidney. You're learning things about gastroenterology or the digestive system. And so you're doing rotations during those 2 years, and that's really to, again, expose you to anything and everything. So you're doing 4 weeks or 6 weeks on OB-GYN, and you're learning what it takes to, provide women's health or deliver babies. You're doing one on general surgery, where you get to be in the OR with the surgeons, learning hands-on what it takes to be a surgeon, and then learning
Mm.
everything else that goes into caring for surgical patients and all these things. So that is where you really get to get your foundation as far as that's when it gets fun, to be honest with you. That's when it got
Fun,
fun for me. Yeah,
fun. So let me ask you this
yeah.
then, because that's when it gets like scary for most people. I would imagine, like actually having to see blood or cadavers, a
Mhm,
dead person, open up the
mhm,
body. H- Uh,
mhm.
how did they prepare y'all for that? Is it like just throw you in the deep end and swim, or do they like show you a little bit at a time to build you up to it? How did they prepare y'all for the I don't want to say gruesome, but that's just where my mind goes when it comes to the body. But like, how do they prepare y'all for that?
Yeah. Yeah, well, most people going into medicine have had some exposure to some of that, whether, it was
Did you? Had you? I
you being
mean, had you seen like the inside
well,
of a body
yeah.
before, or
Oh, yeah, yeah. I had sophomore year, I was in a pre-med program where you again got exposure, so you got a chance to shadow different providers. I shadowed a neurosurgeon in Nashville, actually, at Vanderbilt. And so yeah, I've been in ORs. That wasn't the first time, but that was one of the probably the summer that I got to spend the most time in an OR, where I was in the OR 1 to 2 days a week, viewing different types of brain surgery, stuff like that. So you've kind of had your exposure, and you kind of gotten into it. So it's usually your first surgery in medical school is not the first time you've seen stuff like that.
okay.
Yeah,
Because just as a
usually. So
human being, you have
yeah,
like a you search out for it because you know that's kind of what you want to do anyway
exactly,
already.
exactly, exactly.
Okay.
So you
Have you
kind of
ever
look
seen
into that.
anybody have to drop out of med school? I mean, was there anybody who like couldn't handle it or realized how
Yeah.
to that actually happened?
Well, yeah, yeah, it definitely happens. I think that so it depends on how your school is kind of situated. Some people view the first 2 years as an opportunity for them to weed out people that won't make it. Well, I like to say that the better schools will look at it as an opportunity to for people to figure out, hey, is this really what you want to do? And so, it's something where if you can figure that out in the first year, yeah, people will drop out of medical school. Um, and then other people look at it as, hey, no, it's a tough time, but hey, we expected it to be hard, so let's keep rocking. So I had
Yeah.
before I started medical school, I had an individual compare medical school to undergrad. So I was like, how hard can it be? College wasn't really that rough. We showed up to class, I took an exam, I was fine.
Right.
And so, but then people will make an analogy or a comparison where college is going to be like drinking from a regular water fountain. Compare medical school knowledge to like trying to drink from a fire hydrant.
Right.
And when they said that, I was like, all right, cool. When I
Right. You
got there, I was like, oh,
exaggerating.
damn, this is real. This is
Right.
it is for real like this. You know what I'm saying? Like we're covering chapters in an afternoon. Like I'm like, hold on, we used to read a chapter a week. What are you talking about? But it was so yeah. So what I was saying earlier was like that was the class book stuff, but the clinicals is where things got fun because again, you got to get your hands on and things. You get to learn while doing. You know, so it's you get to completely understand why the shift on surgery as far as following surgeries 10 years ago. They used to keep people 2, 3, 4 days post-op, where now we're like, hey, no, pass gas, then you can go home and you can recover. But now you're taking the sciences that you learned in the first 2 years, and now you're seeing why that change was made as far as post-op care. And so it just made things real, and it was easier to learn when I'm doing stuff versus learning from a book. I've always been a
Got
visual, auditory, hands-on learner. That's always been my thing. Reading was not really how I learned.
mhm.
It was, drawing out body diagrams countless times in a notebook is how I learned anatomy.
Got
It was reading a book didn't work for me. So yeah, but that was so it got fun. It got to be a lot of fun and doing something new every month and a half was also fun for me.
awesome, awesome, awesome. Okay. So now we graduate from med school. The next step is what's the
Oh,
next step?
residency.
Yes,
Hmm.
residency. Yeah.
Residency.
What was that
Yeah, yeah.
what was that like?
So you'll see you'll see kind of there's a I guess there's a pattern for medical education. So there's always a level. So you're on a certain level, and there's always someone above you. Then there's always a next level. So when you're a first year med student, there's always a second year med student that you're learning under, and then the
Mhm,
third year, and then your second year you're learning under the third year, and so on. So when you finish the 4 years of med school, now you're going into residency, which is your actually technically a doctor. So you have your doctorate degree, whether it be MD or DO. Um, but now you're a doctor in training. So now you have to decide which type of specialty you want to go into. Okay, I want to be a OB-GYN surgeon versus okay, I want to be family medicine versus no, I want to do internal medicine or what have you. And that's just
mhm,
based on all of your experiences. But it's a whole nother application process, just like the last one. And so now you're taking your package, your academic package, as well as anything that you did extracurricular wise, and another personal statement or essay. Now you're going to have to go through another application process, which is again, first you have a centralized application similar to when you were applying for medical school.
mhm,
Centralized application, you decide which programs you want to send it out. You just pay X amount of dollars for every program, and they receive your package, they review, and then they send secondaries back to you again. So it's the same process again. So now you got to pay for your secondaries to go, and then they decide if they want to bring you in for interviews. So it's very much like that medical school application process, but you're just doing it now towards residency programs, which are going to train you to be the next surgeon, the next family medicine doc, the next, ENT or what have you.
mhm, mhm.
Mhm.
Gotcha, gotcha, gotcha. Okay. So now residency goes well. After residency, I guess there are a variety of different options that doctors can go into. What are those different options that people usually choose after residency?
So after residency, so now you finish your training, and then to prove that you've learned everything you need to learn during that training, you take a board certification examination. And so that will allow you within your area, whatever state that you're in, saying that you are board certified within family medicine, board certified within general surgery, etc.
Mhm,
That you have to do in order to practice. All right. In order to actually practice and take care of patients, you have to pass a board certification examination.
mhm, mhm,
If
mhm,
you so the big question is when you finish, do I want to practice? All right, and practice means again having a patient panel, working either on your own or underneath the healthcare system, and taking care of patients. Versus, I don't want to practice. This has been a kind of a change. For me, it was always, hey, I'm here. I want to see patients. I want to help patients. I want to take care of people. I want to teach them how to be healthier, etc. But you have a private sector where individuals are paying medical doctors to be, um, you know, you can go academic. I mean, not academics. You can go into administration for a healthcare system. So that means you might be, chief medical officer, oversee from that medical standpoint. You might oversee the credentialing of doctors or what have you. There are different kind of things that you can do with on the administrative side that I'm not super familiar with. But then you can also go into academia. So that means that you can now train physicians without actually practicing, and that might mean that you're in more of a classroom setting. Um, and then the other thing that you can do is you have different avenues within other broader areas of healthcare, whether it be the pharmaceutical industry. So they're always going to be, taking medical professionals as consulting, or as just an individual that's going to be able to serve as a liaison between said pharmaceutical company and the health insurance company, or said pharmaceutical company and say the healthcare system that they're trying to sell their drugs to. And so there are different avenues that you can still create a career as a medical doctor without necessarily practicing. But then again, most physicians that graduate from medical school, with being such a huge investment, are going to go out and practice.
Thank you for listening to Take Your Homeboy to Work Day podcast. This concludes part 1. Check back in on Friday for part 2. But before you go, we need your help to spread our message. So please subscribe, like, and rate 5 stars wherever you get your podcast, and on LinkedIn at Take Your Homeboy to Work Day podcast. Thank you.